Alright, so let's start with today's series of anatomy question. This is the 3. A patient is being tested for a rotator cuff tear. The patient asks the doctor asks the patient to place the back of their hand against their lower back, that's the lumbar spine. Then the doctor asks the patient to lift their hand away from the back. Right, so place the at the lumbar spine and then lift the hand away from the back. So this is just like an internal rotation. Please take note of that. To lift their hand away from their back, that's an internal rotation. Okay, so what muscle is being isolated and tested? So we have what called the rotator cuff muscles, and the rotator cuff muscles they sit around the shoulder joint, right? They sit around the shoulder joint and they act like a cuff to stabilize the shoulder joint and actually to assist movement, all right, of the arm. All right, so we have the a mnemonic for them, which is SITS, SITS, supraspinatus, infraspinatus, teres minor, and subscapularis. All right, so these are the muscles. So what muscles is being tested? So let's look at the key to answering this question is just to know the functions of each of these muscles. For example, let's look at supraspinatus. Just like we talked about in the first episode, it helps in abduction of the arm from 0 to 15 degree. So that's out of it. Infraspinatus help in external rotation. So, and the question we are looking at is an internal rotation. External rotation, just like this, and right, that's external rotation, right? But we're talking about internal rotation of the body. Okay, of the arm rather. We have the subscapularis muscle. Yes, the subscapulary muscles helps in internal rotation. Okay, so he has to place his hand at the lumbar and then lift it upwards. The teres minor also assists in external rotation, all right, and also adduction, a little adduction. Okay, all right, so the answer here is your subscapularis muscle. So let's look at the rotator cuff muscles in proper. You can see the rotator cuff muscles, you can see the supraspinatus, infraspinatus, and teres minor seen at the posterior view, all right, of the scapula. So the supraspinatus, for example, sits at the supraspinous fossa, right, and then it's attaches itself onto the above the greater tubercle of the humerus. The greater tubercle of the humerus, right? Infraspinatus itself sits at the infraspinous fossa. So infraspinous fossa is at the scapula and then attaches itself to the middle part of the greater tubercle. And then we also have the teres minor. Teres minor is seen just below the infraspinatus and then it attaches itself in the bottom part of the greater tubercle of the humerus. However, the subscapularis muscle is actually seen at the anterior view. You can look at it. It's seen at the anterior view of the scapula, and right, it attaches itself to the lesser tubercle, right? The lesser, just the guy just one side. It does not like the others, right? Yeah. So that's the rotator cuff muscles that we have, right? Yeah, you can see a better picture of it. Supraspinatus, the infraspinatus, the subscapularis muscle, and the teres minor. Alright, yeah. So that's all for this episode. So the answer is the subscapularis muscle. The subscapularis muscle. That's the muscle that helps in internal rotation of the arm. See you tomorrow.